The award recognizes organizations that make innovative use of the care guidelines to help deliver effective health care. It's awarded annually in the provider and payer categories. The judges are independent healthcare quality experts who are not current MCG staff members. The judges this year are Liza Greenberg and Michael Millinson, both healthcare consultants, David Nash, who is Dean of the Jefferson Medical College School of Population Health, and Garrett Folk, who is also a recently retired editor-in-chief, and unfortunately could not be here with us today. He was planning, but something came up and he couldn't be here. And I serve as the chairman of the committee. So now I am happy to announce the winner in the payer category. And this is an international health plan initiative to improve utilization, including critical care utilization, within a private healthcare system operating in a foreign country. So this will be the first Doyle Award given to an organization outside of the United States. In 2015, they deployed inpatient and surgical care guidelines in 116 private hospitals across the 8 largest states in Brazil. They reviewed more than 500,000 hospital admissions, including more than 25,000 ICU admissions. Absolutely massive project. And they reduced the ICU length of stay by 16%, and the total admission length of stay for ICU patients was reduced by 26%. They reduced the overall cost per admission of these patients by 7%, while the mortality and 30-day readmission rates remain stable. So this organization is Amil International, which is part of the United Health Group. And accepting the award are Dr. Andre Giapasu, Dr. Alexander Rose, and Dr. Margaret Mary Wilson, who may be familiar to you, having accepted Doyle Award for United Healthcare in the United States in previous years. So if I could ask them to come up here so we can make the presentation. Here you are. Congratulations. Alexander, congratulations.
Thank you.
Andre, congratulations. Thank you. Okay.
Well, good afternoon. This award is really a recognition of terrific teamwork, and I'd like to say thank you to all the people involved. Firstly, to all the nurses and all the physicians from our team who have supported this implementation since the beginning with huge enthusiasm and saw the barriers as opportunities. Secondly, to all the management team who believe in this disruptive yet innovative project. Thirdly, to the MCG organization who provide us with this amazing and very helpful tool, which is consistently improving the quality of care around the world. Finally, to Dr. Margaret Wilson, my mentor, and all the United Health Group leadership who have been so supportive in contributing to healthcare improvement in Brazil. Of course, to my wife, Luciane, and my kids, Miguel and Luisa, that are my inspiration and my reason for living. I'm confident that we are fulfilling our mission to help people live healthier lives and to help make the health system work better for everyone. Thank you very much.
Watch out, Alexandre, because it's heavy, yeah? I'm going to say a few words. I am Andrea. Thank you for this opportunity. As Alexandre said, this work is the result of teamwork. And we must thank many people who work hard inside hospitals, particularly at the ICUs performing their job, to engage Amil patients and ICU physicians to increase efficiency. The background of this work, I work as a critical care physician since the late 90s, have worked in some hospitals, public hospitals and private ones, until two of my mentors, Paulo César and José Eduardo, called me to manage the ICUs at Amil-owned hospitals in 2013. And my goal was to implement evidence-based strategies to increase efficiency at Amil ICUs. I myself was one of the ICU managers at one of the hospitals where Margaret, Hans, Alexandre, and Cristina, my dear leaders, launched the hospitalization optimization with MCG guidelines in 2015. Margaret introduced the idea of implementing MCG guidelines in our hospitals, and many of us asked if that was possible in Brazil. Everything she said was music to our ears. Moreover, I was faced with a completely new perspective of how to manage hospital stay, especially inside the ICUs. My colleagues Danilo and Evelyn from São Paulo joined us to choose the right indicators to follow ICU performances, such as percentage of admissions with right ICU criteria and a loss minus glass, which is we called opportunity in days for the hospital admissions. After 1 year, I intended to take a deep dive into MCG guided data from our hospitals. It was when Alexandre and Cristina believed me and gave me the opportunity to work with them. And data from Amil patients who stayed in ICU through their hospital stay was gathered. I'm so grateful to them. And I had the incredible help of Henry Schneider, my dear colleague from Amil Clinical Intelligence, to gather and analyze our data from MCG Data Cloud. Sidney Franco also helped us to analyze if the increase in efficiency was accompanied by any gain in total costs. And I really believe that efficiency really comes together with controlled costs and increased patient satisfaction. Finally, I'm representing the whole team. We represent the whole team of Amil Clinical Services. Fernando, Cristina, Isabella, Douglas, Sergio, Claudias, many Claudias there. Ana Moisés, Jane, Cláudia again, Paola, Bianca, Ana. Of course, there are many physicians, there are many case managers, and administrative people too, just like André, Rafael. I would like to say every one of them, but there's no time, of course. And this award is the confirmation that we are in the right way to improve healthcare in our country. This is the moment, cannot be possible without all of them, and they work every day to pave the new way in healthcare in Brazil. So proud to represent them. Thank you very much.